Good afternoon. Good afternoon, everyone, and welcome to the webinar, The Role of Mental Health Professionals in Cancer Care. We know this is a critically important topic, and I really look forward to today's event and panel. As many of you know, the role of mental health practitioners with patients who have illness or health concerns is a relatively new aspect in the practice of psychology, and yet it's been around for decades. So the term relative is really operative here. While it's newer, it still has enjoyed a history that spanned decades. Additionally, the research literature with respect to the impact psychological intervention has on both children and adults who have cancer has also grown exponentially. So our roles in the care of patients with life-threatening and or chronic illnesses have expanded and changed throughout the years. We know so much more about the connection between mind and body now than ever before. And as examples of what our role has been as mental health practitioners and continues to be, is including the following, but definitely not limited to. So some examples include supporting the patient at initial diagnosis throughout the course of treatment and even post-treatment, treatment side effects, disease side effects, pain management, anticipatory vomiting, eating issues, sleep issues, disfigurement related to treatment and or the disease, needle phobia or phobia related to other medical procedures that are often painful and very frightening, neurological side effects of either the disease or of the treatment itself, and a myriad of lifestyle changes, including those associated with medical interventions such as limb salvaging in the case of amputation and associated variables such as phantom limb pain and a whole host of family-related issues. I could go on, but it just really demonstrates how broad our role often becomes when caring for these patients. And this list is not exhaustive by any means. The psychologist and mental health practitioner has an invaluable role in their ability to assist patients with this disease. At this time, I would like to welcome our esteemed panel. I'm going to begin introductions today, introducing Dr. Crystal Ortner, who I've had the great pleasure of working with as a graduate student and intern at Nova Southeastern University. I not only had the pleasure of supervising her clinically and teaching her in class, but she has also served as one of, when she was graduate student, of the graduate student coordinators of one of the specialty mental health clinics I ran through the Psychological Services and Assessment Center of Nova Southeastern University. Additionally, and relatedly, during the course of her graduate training, she spent a year at Jackson Memorial Hospital working with pediatric medical patients as part of her practicum experience. So she's addressed individuals with chronic, acute, and life-threatening diseases, both professionally and in all realms of her life. Once she completed her postdoctoral hours and became licensed, she engaged in independent practice full-time. And so exceptional are her skills that she has always been one of my go-to referral sources, as she is one of the best practitioners. And so I snagged her. Eventually, I snagged her when I was at the university, and she returned to NSU while maintaining her practice. She returned to NSU to serve as an additional supervisor part-time within the Child and Adolescent Traumatic Stress Program in the Psychological Services Center where I had the clinic. She has made an invaluable contribution to our profession and as society as a whole. I am now going to pass the floor to Dr. Ortner and the rest of the panel. I kindly ask that you hold questions. They definitely will address questions, but if you could hold them, well, you can write them in the chat, I believe, but if you just know that they'll address your questions at the end of their presentations. Dr. Ortner.
Thank you so much, Dr. Faust. It's been a pleasure working with you all these years and one of the greatest honors of my life. So as you all know, I am a licensed clinical psychologist specializing in working with children and families. But I also have experience on the other side of this topic. I am a stage 4 colon cancer patient. I was diagnosed 2.5 years ago at the age of 34. After extensive, very aggressive chemotherapy, 6 surgeries, life-threatening near-death septic shock, and numerous hospitalizations and procedures that I've lost count, I'm currently in remission, or as we call, no evidence of disease. So we're hoping it stays that way this time. But the main point is not about me or my journey. I think what's most important is what we can take and what we can learn from my journey, so I can impart some information on you as clinicians, educators, and advocates on how to help the cancer community and do better and be better. And so I have 3, main points that I would like to discuss. One of them is to be aware of the stats and the facts surrounding cancer, to keep ourselves healthy as well as our patients, our loved ones, those around us. For example, with regard to colon cancer, most are surprised when they find out that I was diagnosed at the age of 34. Colon cancer is originally a cancer that was only diagnosed in the older adult population, but that has changed. There's been an exponential increase in young adults being diagnosed with colon cancer. In fact, 1 in 5 people diagnosed with colon cancer are between the ages of 20 and 54. It's now the 2nd leading cause of cancer death. And it's most likely due to the fact that there's this huge increase in young patients being diagnosed. And when they are diagnosed, they're usually late stage, because it's not expected that a young person is going to have colon cancer. So they often go years being misdiagnosed or untreated because they're too young to get their colonoscopy, their screening, and it's more likely to lead to death. Also, we've lost just this past year 2 12-year-old boys to colon cancer. So it's now even affecting children. It is no longer a cancer that only affects older adults. And what's unique about this is colon cancer is a silent cancer. So by the time you start having symptoms, you're usually already late stage. So the most important piece to take away from this is that appropriate screening and early detection is what will save your life. Colon cancer is one of the only cancers that is 100% preventable with appropriate screening and early detection. And I'll get a little bit more into that later. So why are these stats important to us as clinicians, as educators, as advocates? It's important to us because a lot of the symptoms of cancer can mimic psychiatric disorders, anxiety, stress, trauma. For example, some of the colon cancer symptoms and warning signs include abdominal pain and discomfort, weakness and fatigue, chronic diarrhea, constipation, change in bowel habits, weight loss, nausea, blood in your stool, gas and bloating. If you really think about this, how many of those symptoms do your anxiety patients also exhibit? Or this is also true among other cancers. Cervical and ovarian cancer often will have stomach pains, back pains. Lung and breast cancer often have chest pains, difficulty breathing, shortness of breath. This can look like panic attacks, anxiety, stress. So as gatekeepers in our community, it's really important that we're equipped with this knowledge and this information so that we can make sure we are not treating people without making sure they're first being screened and ruling out a medical reason for their symptoms, so that we're not treating someone for anxiety when they actually have cancer. So it's very important to be aware of the symptoms, the risk factors, and that we're imparting this information on our clients, our friends, our loved ones, our students, because this information isn't just openly accessible to the general population. So it's our duty as doctors, as clinicians, to do to do better and be better now with this new information. It's also important to know the risk factors as far as when to start screenings. Because like I said, with colon cancer and proper screening, essentially everything, all the horrors that I've had experienced could be prevented. And so this was, after my diagnosis, I did a lot of advocacy work in trying to spread awareness and information to help prevent other people from having to experience what I had to go through. And the standard screening procedure is the colonoscopy. I know when people hear that word, it sounds really scary, but it's not. And it's nothing compared to going through cancer treatment. You're sedated. You're not aware of what's happening or going on. When you wake up, there's no feeling or sensation of the procedure that had occurred. And most people could tend to complain most about the prep, but they do have a new prep that they've just introduced that is supposed to be less aggressive and hard on your system. And if you're looking for a good cleanse, there is nothing like a colonoscopy to give you the cleanse of your life. So do not let your fear of a colonoscopy stop you from getting screened, because it can save your life. Absolutely. Also, because of this huge increase in young people being diagnosed with colon cancer, they recently reduced the new screening age, which used to be 50, has now been reduced to age 45. So if you're 45 or older, you should be getting regular colonoscopy screenings. And that's for average risk population. So if you're at someone that's considered in a higher risk part of the population, then you should be starting your colonoscopies as soon as possible and talking to your medical provider about it. So what qualifies you to be at increased risk? This would be things like having a family history, and that means anybody in your family. I was told that because my grandmother, who is a second-degree relative, had it in her 70s, that I was at not increased risk and that I should start my colonoscopies at 50 like everybody else. Obviously, they were wrong. So, having anyone in your family with colon cancer automatically puts you at a significantly increased risk. Having any kind of inflammatory or irritable bowel disease, Crohn's, diabetes, Lynch syndrome, these are just to name a few. Some environmental risk factors include if you're a heavy smoker or drinker, have a very fatty diet, or if you're obese. So if you have these increased risk factors, you should start your colonoscopy sooner. And again, this information is not just for us, but for us to impart on the people we work with and the people we're surrounded with, so that we can help save a life or two. Another important point that I want to bring up is how to support patients as they go through cancer. There's an extensive need for a strong support system and access to services. We want those who, like Dr. Faust had mentioned, there's a lot of research about the mind-body connection, and we need to have that mind, body, soul working in unison in order to get the best outcome possible. And research shows that, that those who have strong support systems and have access to resources and counseling and are able to fight the battle on not just a physical plane, but also psychological, tend to fare better and have better outcomes. So, having access to services really should be the standard of care. I was very fortunate that being treated at Cleveland Clinic, we were offered complimentary counseling, acupuncture, art therapy, family therapy, massage therapy, and yoga. So they understood that treatment wasn't just about chemo and surgery, that you needed to heal mind, body, and soul. All aspects of who you are need to be addressed and worked on and healed in order to fight this horrible disease. Mental health is just as important as the physical health as you're fighting cancer. And they need to be a united team. Also, I kind of just through my own experience have created what I call like the 4 C's of cancer support. And if you're looking in ways on how you can support a cancer patient, sending a text of, oh, sending thoughts and prayers, that's not really helpful. So some ideas of things that might be more helpful, the 4 C's, the first C being cooking, helping with meals and meal planning. Oftentimes we are incredibly ill and sick from our treatment. We don't have the energy to worry and about meals or make meals, or we're too nauseous to deal with meals. The second one being cleaning, helping around the house, helping with chores. Again, mustering up the energy to do that is often not possible. And there is a wonderful organization called cleaningforareason.org, spelled exactly as it's said, cleaningforareason.org. And if you sign up, if you're a cancer patient, they will come to your home on 2 or 3 occasions, depending where you live, and clean your home for you. The third C is childcare. If this person has children, there are many times as patients that we're going to be away, getting treatment, hospitalized, surgeries. We need help. It takes a village. We need help and have people come in and help take care of and watch your child. These are all active things that you can do to help someone, rather than just saying, oh, let me know if you need anything. No, take action, be an active participant. And instead of saying, let me know if you need something, it should be more of, hey, I'm coming over. What do you need? And what can I bring you? Tell me what to do. Because it's hard to ask for help. We're vulnerable, we're scared. And those people who just kind of take initiative are usually the most helpful in, again, relieving as much stress as possible from our lives, because that way we can truly focus on healing. The less stress we have to worry about all these other variables allows us to really focus on healing and resting and getting better. The final C is to care. And what that means is to genuinely care. That a lot of times what comes with cancer diagnosis is a lot of negative feelings and emotions. And this can make a lot of people feel very uncomfortable. But if you're able to hold space and support someone with cancer and allow them a place to express and process all those negative emotions and validate those emotions, is going to be much more helpful than you trying to fix it and offer advice. Just being heard and listened to and validated is much more helpful. We need time, because once you're diagnosed with cancer, the person you were is gone. They're never coming back, and the life you had is gone. It will never be the same. So there is a huge mourning and grieving process of the person you were and the life that you had. And this takes a lot of time. And this really brings me to my next point of something that a lot of people I find aren't aware of. And it's that the assumption that once a patient reaches remission or no evidence of disease, that they're all better and they're fine and they're great, and you can kind of pull away and they don't need help anymore. And this is the furthest from the truth. I can't speak for all patients. Everybody has their own journey, but I can say in the cancer community that I've been a part of, it's a general consensus that first comes the physical battle, which is the chemo, the radiation, the surgery, and you're in a fight or flight mode. You're just trying to survive. You're in survival mode, and that's the battle. And then once you hit, hopefully, a stage of remission or no evidence of disease, that's when the psychological battle begins. That's when the existential crisis, the constant fear of recurrence, the anxiety, all of the trauma that you've been through just comes crashing in. And like Dr. Faust had mentioned, there are extensive side effects from treatment that can last years that leave you debilitated and still needing support, still needing help. And you can look and appear healthy, but on the inside, you're not, and you're still suffering. So, be aware of that, there are many stages we go through as patients, and from the physical battle to the psychological battle, and it's never really over for us, especially, I mean, if you're a late stage cancer patient, it's never really over. We're constantly faced with the risk of our mortality. So being mindful and aware of that. I was very fortunate to have an amazing support system with my family, my husband, with friends, and within the community, and fantastic doctors and nurses that I think without I would not be here today. So I think having the correct support in place is one of the most important factors that I can highlight. And this kind of leads to, Dr. Matthew Gelazzo, who is a friend and colleague of mine, when he became aware of my recurrence when I was fighting it the second time around. He had seen that I was, working to advocate and spread awareness about colon cancer. And he really stepped up to the plate when I couldn't anymore to kind of take the reins and help in our joint effort to spread awareness and to fundraise. And he created a fundraiser, Walk a Mile or More in Crystal Shoes. And we raised, I think, over 14,000 for the Colon Cancer Coalition to help patients and families also going through colon cancer. And he really built a community army behind my back, and was able to be an advocate to show that no one fights alone and no one should have to go through this alone. And I guess this is where he can speak more about his side of the journey and his role as an advocate and how to be an advocate, because it's just imperative. And so I'll pass over to Dr. Gelazzo, and just want to remind everyone, stay well, be well, stay on top of your screenings, and get your colonoscopy.
Thank you so much, Dr. Ortner, personally, Crystal. Thank you for having me on this esteemed and distinguished panel. Again, my name is Dr. Gelazzo, Matthew Gelazzo, also a fellow Nova Southeastern University alumnus, back 2003, dating myself. Also an Army veteran, was fortunate to serve my country as a psychologist, also a cancer survivor. I was fortunate that my cancer was caught early. I was stage 1 testicular cancer, and have been this year 20 years cancer-free, thank God. So again, thank you for having me. So I want to just piggyback on some points that Dr. Ortner made that I think are important to emphasize and also shine maybe some additional perspectives on it. And the main point surrounds just the concept of support and what that means. I practice full-time forensic psychology now, and I've done that for the better part of the last 15 years. But I used to do a lot of clinical work in the military and outside of it. And one of the credos, or one of the principles that I tried to sort of build my practice around, was really trying to meet people where they are and not where we want them to be. And I think that, you can apply that really to any discipline of psychology, whether it be working with cancer patients, people with chronic pain, or other medical conditions, or people with just chronic mental illness. When people are suffering to a large degree, it's hard not to want to fix them. As Dr. Ortner mentioned, it's not necessarily a helpful approach. You want to try to put yourself in the other person's shoes, as our fundraiser attempted to sort of, spread that spirit across the country, which I think we were quite successful in doing. I lost several friends and colleagues to cancer, different forms of cancer, in the last 7 or 8 years. And ironically and tragically, they were all Nova graduates. But what I will tell you is that all of them had different needs, in my experiences talking to them. What they probably shared more than anything else was a really firm need for privacy. As close as I was to all of them, none of them were particularly proactive in reaching out. And I did the best I was able to do to reach out to them with, I think, varying degrees of success. But ultimately, it's really what the person wants, and as much stress and anxiety as that creates in us as we watch, whether we're providers or support systems or fellow patients, members of the same support group, it's really not our place to try to dictate what a person's recovery path should look like. So, just kind of transitioning from that, what does support look like for people? In my own cancer journey, it was never consistent. Sometimes I had a strong need to connect with other people, and other times I just wanted to be left alone. So it can not only differ from person to person, but it might differ at different stages for a particular person. And to be continuously sensitive to that, I think, is very important. And to try to keep our own anxieties as justified and as legitimate as they are, and not project them onto the people who don't need that. So how does that bring Crystal and I together? Dr. Ordner and I together, excuse me.
That's fine.
I can't help but call you Crystal, I'm sorry.
No, Crystal's fine.
So I had learned of Crystal's recurrence, which was this past summer, and we had worked at the same group practice. We didn't know each other at NOVA. We were about 9 years apart, me being the old. And reached out to her. I had heard about it, I think through a mutual friend's Facebook page. And I'll never forget this. I reached out to her and we talked, and I expressed my sadness for her having to go through this again. And I said, if there's anything you need, please let me know. So I wasn't the best example of being proactive. And her response was, well, if there's anything you need, you let me know. And I was absolutely blown away by that, and still am, in terms of her intuitive sense of wanting to connect with other people, despite the fact that she was going through this terrible illness. And it was so starkly different, and that's the point I really want to make. It was so starkly different than the cancer experiences that I had been exposed to with my other friends and colleagues. And just recognizing that she and I think, shared a similar cancer journey as people who wanted connections, people who wanted to advocate and help others. And that she and I were very different from the other people I had known in that way. Without there being any right or wrong, we were just different. So we brainstormed and we put our heads together and we decided, how can we sort of spread our shared vision of connection and the importance of that with people in the cancer community. And that's where our fundraising effort was born. As Crystal said, Walk a Mile or More in Crystal's Shoes was the name of the fundraiser that became national in scope. Upon concluding my own portion of this presentation, I'll send a link to anyone who's interested in reading more about it in the form of an article that was done. It was a Q&A with Crystal and I, and I'm incredibly proud of it, just in terms of the effort that went into it from our national endorser, I guess you'll say, our charity, the Colon Cancer Coalition. I would encourage you all to read it. There are links within it that will take you to other pages, but it's one of the, again, I don't know if there'll ever be anything that tops that on an emotional and personal level in terms of my own cancer story, and hopefully for others as well. But again, that was the name of our movement. It became a national virtual walk, which took place this past December 4th. And in an effort to express my solidarity for my friend and colleague, I attempted a 100-mile ultramarathon in that day to complete in one day. And I was able to complete 54 miles. And the truth is, this is not a made-up story, my gear was lost. I would have finished. I cursed the gods for losing my gear. But anyhow, we did raise over $14,000 for the Colon Cancer Coalition, which marks the second highest individual personal fundraising effort in their 16-year history. Very proud of that as well. We raised over $22,000 between that amount of money that went to Crystal and her family and to another charity that endorses survivors and support systems for testicular cancer, because I wanted to carry Crystal's example and advocate for my own cancer community. And I'll just say before I close my remarks shortly, that the most meaningful element of what we did is I think we really fostered a sense of community nationally. I made friends who were stage 4 colon cancer patients that will be friends for life. I had people across the country reaching out to us explaining and describing how connected they felt to what we were doing, that they felt a part of something bigger. People with colon cancer participated in our walk across the country. So being a part of that, being able to light the spark for that is something I'll never forget. And so with that said, I just want to thank a few people who made all of this possible, and then we'll pass it forward to our next speaker. First and foremost, I have to thank the Colon Cancer Coalition. They may be watching this. I hope they are. Without their help, Crystal's vision and my vision would not have reached the level that it did. Nova Southeastern University was incredibly supportive, all the way up to President Hanbury. But everyone here on this panel, in some way, shape, or form, helped spread our message far and wide. Carlos deserves a tremendous amount of credit, as does Karen Grosby, the Dean of Psychology. Jay and Amy became friends and colleagues of mine through this process and also helped spread our message. And eternally grateful to everyone for that. The Veterans Resource Center showed their solidarity with us, me being a veteran again. They participated in the walk on December 4th. Irv Harrell with the Division of Public Relations helped get our message out to the broader local community. The Florida Psychological Association, the National Alliance of Mental Illness, and the American Psychological Association all endorsed what we did and spread our message. And then what was quite an honor was that First Coast News in Jacksonville, where the ultramarathon began on December 4th, they're an NBC, ABC affiliate, both major networks. They they produced a video interview with me and an article of what we did on the day of the race. And I'll send that link out to anyone as well who may be interested in that. And that's really it. Again, it's been one of the greatest honors of my life. And I would just echo everything that Crystal said about the importance of support and trying to connect, whether you're a patient or a caregiver, or just someone who's looking to not be alone in their own suffering. So thank you.
Thank you.
Amy, you want to go ahead? Dr. Zeta.
Yep, I'll jump in. Thank you. Hello, everyone. My name's Amy Zadak, and I am a two-time NOVA alum. I have a master's in mental health counseling, and my doctorate's is in leadership and human services. It's interesting. I am a 13-year breast cancer survivor, and I was diagnosed when I was 47. But my cancer journey really started with my mother, and she was diagnosed with breast cancer. And Dr. Ortner brought some very strong points to reemphasize. But one of the things I want to bring up, the beginning of it, because Dr. Ortner, you spoke about fear and being afraid. Well, that's really, I always say, what my mother died of breast cancer because she was afraid. Mm-hmm. So she found a lump, and she had an old-fashioned way of thinking, and also culture had a huge piece. So when I speak about breast cancer, I always, or any types of cancer, I always emphasize how much our belief system has so much to do with the way we follow through in certain aspects, right? So my mother was diagnosed, and she didn't want a biopsy. She was afraid. So when we take a look at cancer, and I was a novice to cancer and never really had to deal with the process. So what we found out is that she didn't want a biopsy. And then by the time she told me about it, it was a stage 4, and she passed away. At that time, I was working on my dissertation, and it was a totally different topic. I believe that the universe or the powers that be lead you where you need to go. And that led me to changing my dissertation topic to the psychosocial effects of grief after a cancer situation. And I think that's one of the journeys that were so powerful for me, because one thing led to another. I started teaching a grief and bereavement class after that. And my focus was textbook, as we all, we kind of stick to the textbook. And then I was diagnosed. And I was teaching that class at the same time. And I think the enlightening moment was, oh my goodness, I have to walk the talk now. I've been teaching students how to deal with grief. Now, how am I going to deal with grief? Excuse me. So I was lucky that I had connected with Bernie Siegel. I don't know if anybody has read his books, but he had Love, Medicine, and Miracles, and it's an amazing book, and I think everyone should buy it. It should just be like a desktop manual. And I couldn't sleep at 3 o'clock in the morning after being diagnosed. Our minds play tricks on us, as we know. We're fortunate as mental health providers that we try to walk ourselves and talk ourselves out of that and not trust everything we think and not believe ourselves. So I emailed Bernie and he emailed me back, and it was the most exciting moment in my life. So much so that my husband's going, "Who's this Bernie that you're so happy about?" I'm telling him, trust me, he's no George Clooney. He's an amazing, enlightening person. So through that journey, and Dr. Orner, you said it takes a village. I had Bernie helping me through. We did a lot of visualizations. I changed my life completely. It was a different way of thinking. The mental shift we have is something that I don't think I'll ever experience to that level when you're in the middle of the diagnosis and the process and the waiting time, because the waiting is so crucial. But I was fortunate to be hyper alert to my environment. And I think that became now the next norm. And I think that's something that I wish we all would have and we would focus on, being hyper alert to messages, to things that happen. I was diagnosed early because of my daughter's pediatrician. And that's what I mean by being hyper alert to your environment and what your messages are. She was going for her check. My daughter was going for her checkup. And we were just talking, and I shared what was going on with my mother. And he said, you know what you need to do, right? And I'm like, honestly, I don't. He goes, you have to get checked every 6 months, not every year. And this is what you need to ask for. And I'm thinking, why would this pediatrician be talking to me about what I need to do? So I did. And he says, and you don't have to do anything. You just have to go every 6 months and take that initial step. So I went to my doctor for my yearly checkup, and I told him I want to get checked every month. He's like, you don't really have to. This was May of 2002. And I'm sorry, 2000 and yeah, I don't even remember anymore. So what happened was I went to him and he says, you don't need it. That was in May. I pushed the topic. October, I went again for my 6 month, and there it was. And it was from nothing to 8 centimeters. So if I wouldn't have done that and followed that message and being hyper alert, I would have been in a different situation. We would have been having a different conversation. So that led me to, again, have a new platform of understanding and trusting yourself. And there's going to be protocols that we follow because of insurance, because of laws, because whatever. But we are our own advocates, and we have to fight for ourselves. And we have to have a voice, and we have to share when it just doesn't feel right. And it's okay not to have a valid reason why it doesn't feel right. Mm-hmm. And those are things that we tend to, sometimes I think that when we're children and we share ideas and they're dismissed, it just confirms that that's how we're supposed to be as adults. So we grow into this, well, if the professional doesn't think so, then I must be wrong. And that may be right, you may be wrong. And that's okay. But the key component is that at least you know you're wrong. And then you can move forward with any diagnosis or any process. So I think one of the firm beliefs that we have to walk away with is to trust ourselves. And in every class, I have the opportunity that I know I have 30 students that I can talk to, and I can help them understand this is your belief system, this is your process, and these are societal rules. And putting them all together sometimes doesn't make sense. But putting them together and you knowing that they don't make sense is when you turn around and say, I think I need an extra step. And that extra step can save your life. So my platform is, since cancer has no age, one of the important factors is just introduce yourself to yourself. You wake up in the morning and you say, how am I feeling today? We question ourselves. We just figure that the days we wake up in the morning and the day's going to be as we thought or we have planned. And how many things don't go that way? But we don't check in on ourselves and saying, how do we feel psychologically? How do we feel emotionally? And how does that affect me physical? Those headaches didn't just happen after an exam. Those were triggers. That stomach pain didn't happen after you were stressed for a week. Those are triggers. And our body's yelling at us, but our minds aren't listening. And we need to just make that connection. And it's such a powerful connection. And the beauty about this connection is then we learn to trust ourselves. And that's the way we heal. When I decided to have a bilateral mastectomy, and I was thinking, well, what about if in 5 years breast cancer is cured and I've made a mistake? And again, Dr. Siegel said, the only decision that matters is the one you make today. What happens in 5 years isn't going to matter. You need to make the decision today. And I think if we all just are hyper alert to who we are and make those decisions every day, and understanding that our health and the way we think will determine our health. Our thoughts will determine who we are. And that was a process that I learned working with a lot of researchers. And being part of the Florida Breast Cancer Foundation, I had an opportunity to learn so much about researchers and the mind-body connection. One wonderful researcher at UCF, actually, her husband's a pathologist. And once you're diagnosed, you learn to love pathologists. So I was always jealous. I'm like, I'm so jealous your husband's a pathologist. You can have great conversations. But those conversations lead you to truth. So one of the blessings that I have is I had the community, we have the community. Nova has wonderful mentors, wonderful professors, and we see it today with Dr. Faust and Dr. Ortner. I mean, what great synergy and what great relationship that created this today. So I think that having this connection and making sure that we continue communicating our fears, our belief systems, and then whatever platform we think is important to discuss, I think we're going to rock it. We're going to fight this. So I appreciate all of you being here and having me, including me in this. And please check in with yourselves. Please check in with your belief systems, and please check in with each other. And thank you so much.
Dr. Trimbadi, you want to go? Okay.
Thank you, Dr. Faust, and thank you for the rest of the panelists for your education and inspiration and advocacy as well too. Now, my name is Jay Trimbadi. I'm a licensed clinical health psychologist in the Metro Atlanta area and working in a large health system. And I'm also a proud alumnus of the Nova Southeastern University. Very proud that we are doing this today, and we are advocating and educating and learning about this concerning topic, where we need to not only help each other, but the community as well too. I've had the pleasure of developing and starting a psychological services center, a psychology department at the Cancer Treatment Centers of America a few years ago, out of fellowship, and it was a new experience for me. I went in knowing that mental health was critical in the cancer space, but when I started the program at the Cancer Treatment Centers of America in Metro Atlanta, I realized that psychology can be embedded in all of these aspects in a cancer center. And fortunately for me, the cancer center, the whole building comprised of oncology, surgical oncology, radiation, and all the subsequent departments, all housed under one roof. And like Dr. Faust said, there are many, many arenas where we can play a role in the space. I'm going to get into that in a little while. In addition to what Dr. Ortner mentioned as well too, is caregiver support. I think that that's a huge space that we are getting into, as well as mental health providers. So for a few minutes, I did send Carlos a presentation. He mentioned that, have a few slides. So I'm going to share my screen. I'm not a Zoom expert. I'm usually a face-to-face expert, and hopefully, we can do that soon. But I'm going to share my screen and have a small presentation for the audience here. And so I wanted to talk a little bit about the role of mental health professionals in cancer care. Like Dr. Faust mentioned a few minutes ago, we do have a capacity to be in many spaces, especially because we can be general and specialized in areas such as pain management, such as grief, depression, anxiety, cognitive testing, personality testing, and so forth. And I'll get to that in a few slides. This is something that one of the biggest things that I've learned about psychologists being in a space is educating the other providers in that space, from medical professionals to nursing staff to admin to everybody in that space. What is psychology and what we can do for patients, for other stakeholders, other employees as well too. We all know, and maybe this is a topic for a different day, but we all know about compassion fatigue and burnout as well in many medical settings. So this is something that I had to express to them. This is something, as a clinical health psychologist, specifically can help with in the psycho-oncology realm as well too, preventing diseases, modifying health behaviors, and improving quality of life. Some of the symptoms that we see, and this is not the extensive list here, these are just a few that we may experience, patients may experience, and their families: depression, anxiety, shock, guilt, denial. Isolation was one that was also surprising to me, that we needed to do a little work on during my time at the center as well. Some of the aspects where we can, as psychologists and mental health providers, can contribute in cancer care, and these are just a few of them that stood out to me during my experiences, is the anxiety, depression, adjustment, personality disorders, diagnosement and treatment for those conditions. We can get into psychological assessment for compliance and adherence. That was pretty significant. As Dr. Ortner mentioned, it is difficult to continue daily doing different types of surgeries and testing and chemotherapy and just being in that space. And she was absolutely right by saying this is something that changes your life. And in order to do that, we have to learn, and we have to adapt and help our patients do those things, because they do have the capacity. Some of the other things that a psychologist can do is pre-surgical evaluations for procedures, for clearance for prostate surgery, colorectal surgeries, coping skills training, cognitive assessments and treatment. Fortunately, I had a great speech therapist in our system that was doing some of these testing as well too, and we're referring out to experts in the neuropsychology field. Pain management was a significant aspect, and almost every patient that we were seeing in the center was also running through pain management as well too. Sexual health was something that I had to get more education on during my time there. This was a significant factor. End of life adjustment, relaxation, crisis intervention, and healthy lifestyle changes. This is a part of my area of interest. So healthy lifestyle changes was a big part of what we did at the center. Things like substance use, alcohol use, tobacco, diet, exercise, rehabilitation, risky behaviors. Like my other panelists mentioned, it's a life transformation when you receive a diagnosis and when you go through these different stages and phases of your treatment and recovery. So these are some of the things that were challenging for a lot of patients that we had. Some of the other things was adherence to medication, looking at healthy lifestyles, like we mentioned, adherence to appointments. Even though we were one center and we had a hotel inside the center, many patients had difficulties adhering because one of the patients I met from out of state, he said, "I'm just tired of being here. I want to go cut my lawn," and that sticks with me because I don't ever want to cut my lawn, but he wanted to feel normal, and he wanted to get out there and cut his lawn and not be in a center like this. And we had to work with him there, and looking at safety precautions post-surgery and adherence to all treatment recommendations. We're working significantly with the providers. It is a huge consultation liaison service in every single department. And I know that different systems such as Jackson and Duke University and Emory and so on and so forth have different types of cancer centers. But the one that I specifically was a part of encompassed everything in one center. So we had to build relationships with surgeons and oncologists and pain management specialists as well too. This is a model that we showed patients and providers. Stress, can influence medical symptoms, and medical symptoms can influence unwanted life changes, which continues on to stress. Just a little cycle that I wanted to present to everybody here, that sometimes we get stuck in this cycle and we need mental health providers and our caregivers and our support systems, and like Crystal says, the 4 C's to continue on and fighting. I wanted to touch base on this and piggyback off of what Dr. Faust said as well too. We have the capacity as mental health providers to be in a variety of departments in a cancer center and in a hospital or a healthcare setting in general. We help folks that are dealing with cancer with adjustment to their medical condition, adjustment to the procedures. A patient may not expect to do a high-tech procedure for their GI concerns a year ago, and now they're getting into this procedure that is pretty invasive and pretty intense, not only for the patient but also for the caregivers and for the staff, for the nursing staff as well too. We're looking at problem solving. People are coming in with a second opinion and how do they want to function in this capacity. Surgical, pre-surgical evaluations, and post-surgical compliance. We can be a help there. One of the things that we mentioned, I think somebody mentioned a few minutes ago, was different types of conditions during their treatments. And one thing I noticed was claustrophobia was a big one for radiation oncology, and we had to work on this anxiety for these patients. And that's something that stood out to me during my time working with patients fighting cancer. Pain management, again, we looked at opioid management. Again, individuals that are going through these treatments and these diagnoses, their resources may have been touched, and they might not have the capacity to understand how to cope well and how to deal with certain things. That's why they do need their caregiver support and support systems like our panelists talked about. One of the things that I've noticed was the opioid use concerns for a lot of patients, because they're experiencing pain and they're using it a lot, like we know, for psychological reasons instead of using it for pain management as prescribed. So that's something that we got into. Rehabilitation. And one of the things that really stood out to me was leadership, the burnout for our physicians, our APPs, our nursing staff, and administration. If you are dealing with this topic for the majority of your career, this is going to cause a little burnout. So we helped providers as well with compassion fatigue and so forth. And when I look at this list, the one thing that comes to me, again, being a proud alumnus, is that these things were taught, these aspects were taught during our time at Nova Southeastern when we were getting trained. I can go off on a plethora of faculty, of distinguished faculty that taught us a lot of these aspects, obviously from the psychological concerns, but from pain management to rehabilitation to dealing with claustrophobia and other anxiety concerns and pre-surgical evaluations. These are things that and Nova was able to impart in us. So just a little boast there about the training that we've received. So yes, we are in so many spaces, not only in a cancer setting, but also in a setting for a healthcare setting. So this is just something that I wanted to continue to keep having, and this is how we were able to put in order and make sure that psychology was seen during that time. So. And that's it. So I appreciate it, and I want to thank you. Thank you for allowing me to be a part of this, and it's an honor and a pleasure and a privilege to be a part of this panel and providing advocacy and education. So thank you.
So we do have a little, we have 3 minutes for questions. If anyone, I think we're doing that through chat, right, Carlos?
That's right.
All right. So if anyone has any questions, please feel free to write it in chat, and I will be the question asker. How's that? I don't see any questions, but does any of the do any of the panelists have a final comment? I have one comment because I could never keep my mouth shut. Anyway, Dr. Trimbadi, it was your point about burnout and compassion fatigue is very well taken. We have a physician close to the family because my spouse had a kidney transplant and can't develop antibodies. And anyway, he, 49 years old, compassionate, fabulous nephrologist, left the practice after watching so many of his kidney disease patients pass away due to COVID, and he just couldn't bear it anymore, which is a huge loss to the medical community. But it's unfortunate that there wasn't a way to help him with that.
Yes, I definitely agree, Dr. Faust. I think that, during our time there, we did rounds every quarter to get everybody in one room, providers that wanted to have a space to provide empathy and understanding of what we're going through. So definitely that happens, and we see this also during the pandemic over the past few years of providers and staff going through compassion fatigue. So that's definitely a topic that we can cover. Mm-hmm.
I just wanted to, go ahead. Go ahead.
No, I was just going to say, I would just, in my efforts to tie together what we've all talked about today, I think it's the universal message here is the importance of staying connected, both internally and among those that you have, a network with. And just,
hey, you know what? I'm going to cut you off because we do have a question. Would you mind? Is this Dr. Lisa Seropian? If this is her, hi, how are you? But her question is, how do you get doctors to come to therapy? Nurses come, doctors won't make room in their schedule. Anybody want to field that?
I'll take that one. It's interesting. I volunteered at one of the hospitals as what we call, they name it the spiritual advisor for the patients, but in actuality, the nurses were the ones who used our services the most when we would be in the ICU. I took care of the ICU units. And in saying that, they were very helpful in targeting certain doctors that needed to listen if that makes sense. And it was probably, we would call it in our professional manipulative way to get to the point, but it worked. And again, you know, nurses seem to be some form of angels that lead us where we need to go. So that's where I would just have casual conversations. So therapy becomes very formal and very scary, especially for physicians. But if you know how to work the system in a very professional and humbling way, then I think we can solve whatever, we can get to from point A to point Z. It doesn't have to be our traditional therapeutic process. That was my experience in that.
And I wonder if it would make it almost more accessible or easy, and rather than having the doctor come to your session, what if the psychologist came to your appointment with the doctor? That way it's not taking time out of their schedule. They're already there. You know, the therapist or psychologist would have to be willing to do that, but that might be another loophole.
The traditional therapy that we're used to, which is the office, really doesn't work. What really works is real time, right? So even your clients, what's happening real time? If you come and tell me a week later, the energy, the process, we've lost so much of the healing process right there and there. So I think that's brilliant to have, you know, the therapists come to the sessions and assist and be there real time.
Yeah, even working in peds in the children's hospital, having during clinic time and sitting in the triage room with the physicians and letting them vent and offering support. It's not traditional therapy, but it certainly went a long way to manage stress. I guess we're out of time. I say we do part 2 eventually. What do you guys think?
Sure.
It was great.
Thank you so much. I very much appreciate being able to speak today. And
Yes, I second that. And just to finish my earlier comment, I just wanted to again, I guess, drive home the universal message that I think we all tried to share in some form today about the importance and the power of connection, whether it be listening to people share spontaneously or offering support and creating an environment where it feels comfortable to share. And as Dr. Zadig said, you know, trusting yourself and trusting your feelings and not having to apologize for being exactly where you are at any given point in time. And just to go completely off script for a minute, I just want to publicly thank Crystal for being, I think, just a beacon and a role model for everything that we've talked about today. I mean, in my mind, she's a hero.
oh, thank you. Thank you. I couldn't have done it with all of you guys, so thank you.